Dr. Amit Shah and Dr. Kathy Richards. They will talk. We'll start with Dr. Amit Shah. Is a radiologist for Leicester.
Thank you very much. Thanks, Anita, for inviting me today. So my name is Amit Shah. I'm a consultant radiologist working here in Leicester. So what do? You may not have come across a radiologist. You will know you're a surgeon, GP, or medical specialist, but we are hidden somewhere in the hospital. But we are very much part of your treatment. If you've ever had an X-ray, CT, MRI, all the reports are done by us. You may have come across us if you've ever had an ultrasound. We do see patients occasionally, and we will perform an ultrasound. There are some of us that do intervention, which is basically non-surgical way of either obtaining tissue if we do a biopsy or draining fluid, so avoids the need for surgery. So if we talk more about fibromatosis, so if you imagine you have a lump or you find a lump one day and you think, oh, this is not normal, I'll go to my GP. GP will examine you and decide, I think you need an ultrasound. So you'll come to me or someone who does an ultrasound. So we'll put probe onto your lump. So here we say the tummy. So this is the probe, this is just skin at the top. You have your normal fat layer here, and this is your rectus abdominis muscle, your six-pack. The arrow here, this white bright line, is a thin layer of tissue which separates the outside from the tummy contents, so your bowel. So you can see it's a very thin line in between. So if we take, for example, your lump, so what we'll see is that there's some rugby-shaped mass here. It's very dark, and we know it doesn't look normal. It's not your normal muscle. So at that point, what the reporting or the sonographer or the radiologist will do is will say, this is not normal. This needs to be discussed in a meeting, multidisciplinary team meeting, with a number of specialists that deal with lumps and bumps. So that's what we do. We sit around, no coffee, we do some work, we look at the imaging and decide, right, this is not normal, we're not sure what it is, we need to do something further. Often you will have an MRI so that we can see where the lump is in relation to any other structures, so then we can decide what is the next step forward. Now, within the NHS, there are special pathways for a number of diseases where if you fulfill the criteria, your GP can refer you urgently to see a specialist within 2 weeks. In Leicester, and what happened in a lot of other places, you will see the surgeon and on the same day have an ultrasound, and on that same session, we will decide whether you need further imaging or you can just go home. So that negates the need to have an MDT process in between. And then once you had the MRI and we've all looked at it and decided, we're not sure what this is, you need to get some tissue because ultimately the diagnosis is done on pathology. So you'll come back to me as a radiologist. I specialize in lumps and bumps, and we will obtain the tissue sample without the need for surgery under local anesthetic. So you'll come to my ultrasound room. I'll do a quick ultrasound just to prepare what we're going to do, how we're going to get to the lesion. I'll get the trolley set up, get everything sterile, and then we'll clean the skin and give you some local anesthetic to numb the area. That dusting, but it should take away the pain, but it doesn't remove the sensation of pressure or pushing, so that's all you should feel when we do biopsies. We'll make a small nick in the skin, about 5 millimeters, to allow our needle to go through, and then we'll put the biopsy needle in under ultrasound guidance so we can see exactly where we're going. This is what we see. So this black stuff is the lump. this white straight is the needle that's outlined in the red. So we can see exactly where the needle is, making sure we're in where we need to be. Just a few cases now. So there's a lump, it's black here, I'm not sure what it is. Here is the six-pack, so we know it's well below it, so it's inside the tummy. We'll do a CT scan because it's inside, that's the best way to image it, and we can see there's a lump just here under the rectus muscle. So this case actually, the patient underwent surgery, and then a few years later had another lump, this time in the rectus muscle. So they can, or they are very prone to recurring, which is why, as we heard earlier on, we prefer to watch and wait rather than to operate. Another case here, so you can see the star is just pointing to lump. The white stuff is a bit of dye that we put inside the patient who swallowed it, so that's the bowel. So we can see the lump is surrounding all the bowel. And this white structure here is a major vessel in the body, so you can see it's quite close to some important structures. Just another view taken on the side. You can see here's a lump. This case, because of the symptoms, we decided it needed to be operated on. You can see now it's gone after the operation. As we've heard, Desmoid fibromatosis can occur anywhere, so commonly in the abdomen, on the tummy, but it often occurs in the limbs. So here's the knee joint, and at the back here you can see outlined in red, it's this mass here, and you can see these dark lines. That gives us a clue as to what we think it may be. This is another example. This is the buttock, so this is buttock in the back, that's the front, that's a hip joint here, and here in the red is another DF. Just another example in the leg, so this is your shin bone, and you can see this is back of the calf, this is front, there's a big lump here that's going all the way through it and infiltrating both the front and the back. So this case can be very difficult to surgically treat, which is why we want to do watch and wait. Not every lump is a DF, as you will know. It's a very rare tumor amongst a lot of things that can potentially cause a lump. So another case, the yellow outlines the rectus muscle, but there's something black in it. I'm not sure what it is. So we do an MRI, and you can see here there's a lump in the rectus muscle. We do a biopsy, and it shows hematoma. So that's a blood clot or a collection of blood that's occurred inside the muscle. So often the history, so if there's been injury or if you're on blood thinning tablets, you can get bruised inside. So not everything is a fibromatosis, but it may look like it, which is why we often have to do a biopsy. Just another case. Here again you see something black. This is a rectus muscle here. So something black in the muscle. It may be fibromatosis, but we know it may be something else. We do an MRI just to get a better image of what it is, and then we do a biopsy. And this turns out to be endometriosis. So endometriosis is where you get the lining of the womb, so obviously just for females, lining of the womb, and that can actually get implanted into the muscle layer. Often happens when you have a cesarean section. They cut open the womb to get the baby out, and the tract that is caused by the surgical incision leads to implantation of the lining of the womb cells into the abdominal wall. Just like your normal menstruation, because they undergo cyclical change, you'll get cyclical pain and discomfort, and that's how often they may present. So not everything is a fibromatosis, but yep, you'll see us to have an investigation, so we're part of the team. Thank you. Any questions?